Hi, everyone. Today's episode is a special one. I'm joined by Mike and George, the passionate founders of Families Out Loud, an incredible organization dedicated to supporting LGBTQ plus individuals, couples, solo parents, and allies through every step of the family building journey. Mike and George's own path to parenthood was filled with uncertainty and unexpected challenges. From the overwhelm of not knowing where to begin to a challenging delivery experience, they deeply felt the weight of navigating this path on their own. Turning their journey into purpose, Families Out Loud creates inclusive, informative, and welcoming spaces where others can find clarity, connection, and community. So whether you're actively pursuing parenthood, just starting to explore your options, or unsure where to begin, their events offer expert guidance from trusted industry professionals on surrogacy, egg donation, legal considerations, and more, all in a space where you can feel seen, celebrated, and supported. We're incredibly proud that Egg Donor and Surrogate Solutions is one of the partners in this amazing work, and we're so honored to be part of the community they've built. Their story is filled with heart, humor, and honesty, and yes, even a little bit of drag flair along the way. I can't wait for you to hear their story and learn more about the impact they're making through Families Out Loud. Enjoy! Me, you, and who? Who knew it would take more than two people to have a baby? In a world where infertility is no longer a taboo topic, this podcast will take you through all of the different aspects of surrogacy and egg donation through the lens of many who walk this journey in different ways. My name is Whitney Hall, and I am a two-time surrogate, now turned surrogacy coordinator for Egg Donor and Surrogate Solutions, the very agency I used when I chose to carry for two amazing families. With this podcast, it is our goal to help guide and support you as you learn about what it takes to grow a family in an alternative way, as well as hear inspiring and beautiful stories of how this path has changed lives forever. We can't wait for you to hear about just one more way happy families are created every day. Well, you guys, really, thank you so much for joining us and getting to be a part of this. I'm so excited to get to talk to you, Mike and George from Families Out Loud. For our listeners who are just listening and not watching, why don't you guys go ahead and introduce yourselves so they can hear your voices?
Even though they're somewhat similar. So I'm Mike. I am one of the co-founders of Families Out Loud and acting as CEO right now. And so, yeah, that's me.
Hi, everybody. I'm George. I'm also with Families Out Loud, co-founding with my husband, Mike. And we also are two dads to two 3-year-old twin boys through IVF and surrogacy.
Yes, twin shout out. I have twins of my own, so yes.
So you're busy.
Yes, you understand the struggle for sure.
Oh yes, and three is a special age.
That's such an appropriate way to put it.
Yeah, everyone warns you about terrible twos, but really it's the threes that you have to watch out for.
Yeah, everyone has been saying you have a bunch of three-nagers, and that's accurate.
Absolutely. No, that's exactly right. That is so right. Oh my gosh. Well, I thank you guys again, just, for being here, but to go off of these fabulous little 3-year-olds, can you guys, let's go back before we even get started on Families Out Loud. Yeah. Can you guys share a little bit about just y'all's journey to parenthood?
Yeah, go for it.
Oh my gosh.
You start.
I'll start. Okay. So this gives a lot of context of where Families Out Loud even came to be, because our journey was actually extremely bumpy. And so we started out not knowing basically anything about the process. We didn't know what step one was. We didn't know what the step before step one was.
Sure, absolutely.
And so we kind of just were winging it from the very beginning.
Yeah, Google was not very helpful, really.
We didn't have any other gay dad friends. We didn't know any other families that looked like what we wanted. Right. And so we struggled a lot. But then eventually we went for our surrogacy agency first and figured that out, which was, looking back, the wrong first step to make.
Or just not like the right
not
order.
the right way to do it.
Sure.
But we found that. Then we went for our fertility agency, our clinic. And so we found them. But basically, we went through one surrogate, had a pretty shaky experience with that first surrogate, but then got rematched with our surrogate, who we now absolutely love and adore. who we still have a very great relationship with, as well, and her husband and her kids. And then our children were born, 10 weeks early, at 30 weeks.
Yeah, they were born at 30 weeks.
And they were NICU babies, but we found out that they were being born the night before their baby shower. So we had a bunch of friends and family staying in the house.
And one too many cocktails as well.
We were like 3 sheets to the wind.
Excellent. This is how we start off parenthood. Absolutely.
Yeah,
Yes.
Yeah, on the right foot, for sure.
And so, we didn't have any baby stuff yet. We didn't know what to expect. We're like, our kids are being born. We live in New Jersey. Our children were being born in New Mexico. And so we knew we had to get on a plane, but we had no baby stuff.
Mind you, it's also like 1:30 in the morning Eastern, and our surrogate was in labor there, which is Mountain Time, which is like 11:30 p.m. So there was no flights. Our mothers are like hysterical crying with joy and fear and all the emotion.
And ripping all their presents open for us.
Yes, it's like, here, I've got baby stuff. It's fine. Yeah.
But not realizing that it's the NICU and
they're not coming home right away.
Not only that, but it's not even like preemie sized clothing, which is not something that anybody took into account.
So they were born at 3 pounds each, around 3 pounds. So they were very, very tiny. And so we got on the next plane at 4 o'clock in the morning.
Yeah. Footnote though. So our children were born in the state of New Mexico, which is where we had our parentage set up, but they had to be airlifted to El Paso Children's, which was the closest level 4 NICU. So we didn't have parentage rights in the state where our children were now being kept.
Right.
So our attorney had to get on the phone with a judge and make sure that we had parentage. So we had to wait in the hospital for a few hours before we were actually able to see our children.
Yeah, we had an amazing attorney. His name is Rich Vaughn, plugging his name because he is literally...
Oh, they're great. They're great.
Love
yeah, absolutely. Yes, that whole team. Molly, oh my gosh, yes, 100%.
And he was really the first person who was like, I'm going to help guide you guys because there really isn't a lot of information out there. And so he's like, I'm going to make sure that you go through this process the best way possible. Because he met us kind of after we had really struggled a lot.
He met us after all of our bumps and bruises.
And so he was there and he really guided us through the parentage piece. And so we showed up to the hospital, the NICU in El Paso, and they're like, you can't see your kids because they weren't transferred here in your name. So we can't let you see them.
Oh my gosh.
So then Rich and his team got on the phone with a judge in Texas, and then he approved it. And so after 3 hours of us standing there in the waiting room with our kids literally on the other side of the wall, we got to go in and see them, and we had our skin to skin, and it was obviously the most magical experience, I think, of our lives together.
Magic with a sprinkle of trauma.
Yeah.
But it was good.
I was about to say, it's one of the, you guys, I feel like this is you find the word chaos in the dictionary and this is the picture of it.
Yeah, it was.
My Lanta.
It was definitely chaotic.
And so then to add another level to it, obviously we couldn't live in El Paso for however long the kids were going to be there. So we flew back to New Jersey, and
we spent 2 weeks.
We spent 2 weeks there.
Then we would fly home for 2 weeks, then go back for 2 weeks.
Because in the NICU, they have to hit all of these different milestones before they're released. And so there's the car seat test and all these different things. And we had no idea that any of that was going to have to happen.
And neither did our families. And our families ever so graciously, they're not pressuring us, but constantly when are they coming home? What's happening? Why are they not being released yet?
You have to get your kids. And it was we were trying to explain to them how the NICU worked without really knowing how the NICU worked.
Yeah, it was a lot.
So we came back after 2 weeks, and we hung out here. And then finally, James was ready to be released. It took him a month to be released. Our first child. He was actually the firstborn too.
Yeah, by 5 minutes.
So we we picked him up.
If he knows that, he's going to hold it over his brother.
Definitely. Yeah. As brothers do.
As he should, because Anthony is definitely bossing him around.
But so we brought James home. And then a month later, we had to go back again and pick up Anthony and bring him back. So we had to take newborns on flights. Mind you, they had just lifted the mask mandate after the pandemic.
On airplanes.
So there's just...
So we were obviously, we weren't super crazy about the mask because frankly wearing it on a plane was a lot with a newborn, but also we were we don't care, we'll wear the mask. But of course now everyone's oh, thank God I could take this mask off. And it was fraught with a lot of issues. And we were just so hovery at that point. And what's so crazy is that we didn't realize how many people want to touch and see and
Your
kiss
baby.
and feel your baby.
Oh yeah.
It was like everyone we met, and it's very gracious, and I appreciate it. But
please don't kiss my baby.
Right, we're in a pandemic. Please don't touch my child. Like, they're also a preemie, and like, what are you actually doing?
What are you actually doing? Well, and it's so funny because that's like an issue. That was an issue prior to pandemic, and the pandemic, and then post pandemic. It's like, you guys, come on, we like just had a whole like thing.
Right.
And
Did you like not remember where we were just a few months ago?
Literally just a few months ago. Oh my gosh, you guys. I mean, I feel like this is only a glimpse of your story, and I feel like this is just an exact reason why it is so important to build a trusted team that knows and experienced, and they know what they're doing. And you know, just in my head, I'm thinking, because you know, my bread and butter is coordination. So you know, I took people through that surrogacy journey, and I'm hearing all this legal stuff, and I'm like, wait, why wasn't this thought about before? I don't know. I'm just like, so many things here where I'm like, if you have the right team, lot of you already are in a crazy chaos situation, but a lot of the extra stuff of sitting for 3 hours while your kids are on the other side of a wall in a totally completely different state than we were anticipating
could potentially have been avoided, like
potentially avoided. Yeah.
Exactly. And I think we don't know what we didn't know, right?
Like, well, how could you?
We were just going along with it. We're like, okay, how do we overcome this obstacle? How do we overcome this?
And like, you know, we both do coordination in different ways in our quote unquote real jobs. But you know, with that, like, you know, some of the things you could have asked are like, well, what level NICU is this hospital? We didn't know to ask that. And like, in the event, now that we know, like, likely event that our children will be born prematurely, will it be able to support? What's the backup plan, so that we could have, to your exact point, Whitney, prepared for this?
And our surrogacy agency didn't secure insurance for us and asked us to pay out of pocket, right?
Well, they were supposed to have secured an ACA policy for us, and then never actually secured the ACA policy for us. Mind you, they no longer exist.
Yeah.
So like, it's okay. So they are no longer, for anyone listening,
they can't hurt anybody else.
They can't hurt anyone else.
But those problems could happen with other agencies, and it's always good to have a trusted partner.
To your point, exactly. And that's why, not to start talking about it prematurely, but like Families Out Loud, the whole reason why we even wanted to create it was to bring trusted, vetted partners to the table for individuals such as ourselves who walked into a room or a space and were like, I know nothing and no one.
Yeah.
And I just want to meet people who literally have my best interests at heart. And that's why when we met Katie and Egg Donor and Surrogate Solutions, it was just kind of like kismet, because we were like, oh my gosh,
you're our people.
You're so lovely. You care about your intended parents. You care about your donors. You care about your surrogates. You care about your outcomes. And like, that's what's important, right? Like, that's what makes sense.
And to take a step back, Mike also, after we had our kids, Mike started working at another agency. Mm-hmm. And so he also started learning about like all the right ways to do this.
Right. Like, no right or wrong way, but
like correct, the normal pathway for this to happen. And so we started getting like, we kind of got like angry. First we were angry because we're like, wait a second, we could have done it this way, and avoided all of this stuff. So knowing what we need then, you know, and so that's where people started asking us questions on Instagram, right? We started getting DMs like, oh, how did you guys know where to start? Like, what about this? What do you think about this? And so we started just answering people, and like, we wanted to start spreading the best information to people because we didn't have that. And so we're like, let's give this to other people. And then we started thinking about, well, how can we do this on a larger scale where we're not just like DMing people back and and we can like share it and like, you know, spread it more broadly. And so that's where Families Out Loud really came from. And we also like drag queens, so we'll get into that too.
Yeah,
that's
absolutely.
It's a wonderful idea born out of trauma, as we talked about.
Yeah, for sure. Well, again, I mean, I think to your point, right? Like, when you guys were first starting, so before trauma, when you guys were first starting, you go to Google and you're just overwhelmed. And I have talked to so many people who have had such similar experiences of either they, you know, did get looped in with an agency and they had no idea that, hey, there's actually this whole like ethical standard like thing called, you know, SEEDS. And if your agency isn't part of that, you might want to rethink. Or they did go, well, we know we need egg donor, but we're going to go get a surrogate first, not realizing that, hey, let's flip-flop those steps, and here's why. And just all of those little nuanced things, you don't find those on Google because you don't know what questions to ask.
Totally.
No. And that's what's so great about, like, when you go to Families Out Loud, if you have no idea what you're doing, you can go there, and every single person that's a part of the journey, or that's supposed to be a part of your journey, is there. They have a table there. So you're like literally walking around the room and you're meeting every single person that needs to be a part of your journey. And that's what's so great, because sometimes, like, there's events where we go and it's so overwhelming because you don't know what the purpose is. You don't know, like, who's there, what they're there for, what I need. Like, we try to bridge that gap by having everyone in the same room and also making it conversational. So it's like very approachable. And it feels much more like an intimate, personal conversation rather than like being sold a million different times.
I agree. And I think like what it's just overwhelming is the right word, right? And I think that we want our events to be warm and welcoming and comforting, and for all walks of life, right? Like, yes, we're a gay couple. Yes, we're a same-sex couple, but we want to support everyone, right? Yeah. So in my capacity, so I work for San Diego Fertility Center on the outreach team, and I literally speak with just about every single intended parent in the United States and Canada who goes to SCFC. And what's great about my position is that I speak with everybody, right? So I speak with single individuals, I speak with heterosexual couples, transgendered individuals, every walk of life that you could potentially imagine. And so much of the feedback that I hear is like, there's no place for me to go, right? That I feel comfortable. And especially so many intended mothers and women that I speak to, right? And it resonates with me so much because so many of these women have such similar stories, but they're not talking to one another, right? Like so many of these women have, it seems like the theme is trauma, but trauma or like serious, right? Like it seems like bad but true. And they've gone through so much. And now they're at this point where they've been through a lot of mental health providers and whatnot to get to the place that they are to even have the conversation with me.
Absolutely.
And like, how impactful would it be to be able to be in a space where they can meet and speak with other women who are having very similar experiences to them and be able to share that with other providers.
And also other men who have surrogates that are going through the same problems sometimes, you know? And I think that just like providing access to that space is so important, and also making it less taboo to talk about because the space feels so safe, it feels so inviting. There's drag queens there, there's just people, there's heterosexual, homosexual, like any person can be there. And so it feels like a safe and welcoming space to talk about it openly because everyone's there to literally talk about it too.
Yeah. And like, I certainly don't want to get political on this podcast at all. But what I do want to say is that it's clear that reproduction is on the topic, right, of everyone's minds in the United States.
Absolutely.
And, you know, when you're thinking about that, you absolutely have to think about this world. And it's providers such as yourselves, it's providers such as ourselves who are going to shape this entire community. And let's do it in the right way, in the most loving, caring, and supportive way that we possibly can, because it definitely has a certain ick factor to it for some people if it's not done the right way. It could feel greedy or overbearing at times, and that is certainly not what we want anyone's experience with this world to be. It's supposed to be a place that you can lean your head on someone's shoulder and be like, okay, like I need you, help me like through this. And that's the way we view it, not only with Families Out Loud, but even just as individuals, as a couple who are dads. Like, I think that that's how we think about the entire process for everyone.
100%. I think one of the things that first of all of that is just said so beautifully. And one of the major anchors that you kept referring to was this idea of safety and comfortability and community. And I think especially in, you know, you're pointing out, you know, women who have gone through, you know, trauma, and then of course the LGBTQ plus community. And I mean, comfortability across the board, right? Whenever you're thinking, I mean, I was speaking to a physician, and just thinking about when you're walking into a fertility clinic and you're filling in applications, does that application, or, you know, does that intake paperwork say, you know, mom and dad, or does it say individual? Like, just those types of things, and being conscientious of that,
Mhm.
and being directed to providers where that's not necessarily one more hurdle that you're going to have to
Exactly.
go over, I feel like is so important. So for Families Out Loud, what do you think kind of, sets you guys apart? Because you have, like you said, you alluded to, I think, George, you had said you had been to some of these other, kind of convention type, situations,
Yeah.
and it can feel overwhelming, and that ick factor and salesy, and, and you're also just like, I don't even know where to go. What sets you guys apart from that? And please talk about the drag queens at some point.
Yeah, I mean, so we can start with the drag queen for sure.
Because we love them.
Yeah, because we love them. We just feel like having a drag queen or drag queens, because there's always going to be multiple, it already sets up the space to be like safe and making it fun and lighter.
Yeah.
And some of the different places, not to talk badly about any other organization, because every organization that's doing something for this in this space is valuable and absolutely necessary in some capacity. But we just wanted to make it fun and like lighthearted, and like that's the whole piece about safety and like getting rid of this taboo. That's really where the drag queens come into play for us. And then also, what was the other thing we were mentioning before about Families Out Loud, and like having like a trusted group that we know all these people, everyone that's there, we know personally,
right?
And our biggest, thing that we wanted to make sure Families Out Loud did was provide trusted partners. And so that's who you will meet, are people that we personally are invested in, and who are also personally invested in Families Out Loud.
Right.
And that was really important to us too.
And I think to like go deeper, like on the drag queen conversation, it's not just because they're amazing individuals and that they have their own story, right? Whether it's with like reproduction or why they even do the art of drag and why they've even come to that. Outside of that, there's just something that's so impactful. And I think there's something amazing about a drag queen that allows someone's like these from shoulders up here to just kind of relax for a minute and like not let your guard down, but be able to breathe into a space. Right. And we have a drag queen on every single one of our panels now. And we find that so impactful. So because there's something that can just feel so clinical about like a dais with like a bunch of panelists, and they're just sitting up there with their hands crossed, right? And they're like, this is what I present. And like, it's just different, right? And what we want is more interaction. So it's a drag queen asking a physician a question, asking a program director a question, right? A mental health professional a question on the world, and then opening up to the audience and saying like, hey, like, what do you think? And, and when someone who is a quote unquote professional in this world does that, it doesn't make it feel as accessible. But when you have a super famous drag queen from RuPaul's Drag Race being like, what do y'all think about this? People are going to be like, oh, actually, yeah. I think it just, again, disarming, but also welcoming, and just more inclusive.
Yeah.
The other thing that Families Out Loud is doing, and we'll be doing this at the New York event, on May 2nd.
Yes, at the time. So yes, sorry, and I don't mean to interrupt you. So yes, so again, going back just a touch, Katie, our executive director at Egg Donor and Surrogate Solutions, got to be a part of the Austin event, and oh my goodness, she couldn't stop just oohing and awing over it. I mean, she had so much fun being a part of that, and we are just so grateful that we get to partner with you all in this space and with all of those individuals. At the time of this recording, we haven't quite gotten to the New York event, but we will be going to the New York event.
Yes.
So I guess by the time this drops, New York has already happened. But
yes.
So take it away, George. You guys are also doing some other special things.
Yeah, so this is our first event where we're actually having, and we're going to continue this on for our next event in San Diego in July. And we're having giveaways. So the providers, some of the providers that are joining are actually we're giving away up to $130,000 worth of just like the giveaways. So where you could get money off of your legal fees or your surrogacy fees, and you could potentially walk away from our event with like $13,000 towards your journey.
Well, what's amazing is that, for example, right? So like Katie and Egg Donor and Surrogate Solutions has graciously offered to waive your fees for an egg donor journey for one of the giveaways, right? Which is incredible, right? Like, how amazing to be able to approach your journey with a provider such as Egg Donor and Surrogate Solutions and having your egg donor agency fee waived. Like, that just makes
life-changing.
It's not only life-changing, but it just takes, again, some of the pressure off of you. Like, that's a serious amount of money that someone is able to now enter into this journey with potentially a little bit less trepidation than they had before.
And you have a great partner also.
Right. And like, it's what's so impactful is that, to your point, these amazing partners are who are doing this, right? Like, they are the ones who are, giving these giveaways to anyone who comes to our events, which is amazing. And then even further is we just recently, the other day actually, just partnered with Lauren and her team over at Chosen Fertility Group, which is a grant organization that's relatively new to the scene. It's about 4 years old. And what's so amazing about them is that they are the first fertility grant organization that has grants for IUI, IVF, surrogacy, and acupuncture. And that's what's so amazing about this organization, where they're able to get grants for all those different types of solutions that individuals need in the reproductive space. And we partnered with them at Families Out Loud, where we're going to be giving 1 or 2 grants in the IVF and IUI space, so that it is a more inclusive environment for everyone. And we'll be, accepting applications at Families Out Loud. And at every other Families Out Loud event, we will have one of the giant checks where we give away a huge lump sum of money to a grant recipient, which is going to be super exciting. So it'll be very cool.
Amazing.
And that's really like Families Out Loud is really there to provide, like we said before, like the access and like it's like visibility, it's access, it's community. There's so many parts of Families Out Loud that make growing your family just a little bit easier than it would be if you just were doing it on your own. And you also get like Mike and I as support systems through all of it.
Yeah.
And we're happy to help too.
Yeah.
100%. So just after hearing all of that, what do you hope someone feels whenever they walk into one of your events, and maybe whenever they leave one of your events? And I feel like you've kind of already touched on it, but
well, I want someone to feel like joy, right? Like, I want someone to walk into one of our events and just be overwhelmingly happy, because we've been to, as George was mentioning, so many conferences where the two of us have stopped individuals and just grabbed their hands and said, "Are you okay?
Breathe.
Like, take a second, take a beat."
Yeah.
Right? Because they are quite literally stark white and wide-eyed, and you can sense this fear and trepidation, and that's not what this should be at all.
Yeah, we want people to walk out the door of the family planning event and be like, "Oh my God, that was so helpful. I feel like I know what I have to do now."
Yeah.
And then I hope they leave the drag show later that night, like wiping the sweat off their face and like feeling so good and being like, I actually got to enjoy this.
Yeah.
And like, it was time well spent for so many different reasons. We hope we get both of those reactions, because that's how we wanted to feel after we left. Maybe not wiping the sweat off our face, but that's how we wanted to feel leaving. And we kept on feeling like we would leave with more questions. And leaving Families Out Loud, you're going to have a list of people that you want to talk to the next day,
who can answer any questions you have. And you'll feel good about reaching out to those people, whether it's to a provider you met, or whether it's to George and I, or whether it's to anyone that you may have met, or potentially another parent, because we also invite current parents, right? And just say, "Hey, I met this another amazing couple that has already been through this process. Maybe we grab coffee with them and we learn a little bit about what their experience was like, if they have never met anyone who's gone through this before, to have that personal interaction," right? So like, that's the whole idea, which is why we have a huge drag show at the end, not to just celebrate, but to also bring communities together, right? Absolutely. Like, it's meant to be an inclusive space where everyone can share ideas and learn, dance, and have a great time.
Yeah. And like, we've met, other gay dads who are a little bit older than us, so their kids are a little bit older, and we ask them questions like, "Well, what's middle school like? Like, what is high school like?
What's college like?
Like, what are some of the things that you face? Or like, is it harder? Is it easier? Like, with the social climate, like all of these things." And it's really insightful, because we get like a little glimpse of what the future looks like, even just a few years ahead. It's so helpful to know what that looks like, or what it could look like and what to like be prepared for. And building that
Yes.
community is so valuable.
Because people don't think like about like when are those questions going to pop up with your kids, like those where did I come from questions, or like why did you do surrogacy, and like all of that. And it's so nice to have multiple different opinions and hear how other couples or singles or individuals navigated that entire process, to just say, ooh, okay,
I like what you did there.
I like
I'm
that.
gonna keep that in my pocket for when I get the rest of.
Yes. Well, I mean, George, to your point, you had mentioned from at the very beginning, whenever you guys were like, hey, we want to have a baby, now what? You didn't have that community. And this community is, and Mike, you know, in your experience, whenever you're talking to, you know, potential intended parents, you're hearing from all of these women who, like you said, they have such a similar story, but no one's talking to each other.
Nope.
And so to bring people to a space where something that can feel so daunting, or something that had so much trauma come along with it, and to come into a space where it's happy and joy and just a beautiful celebration of building your family in this way.
Yes.
I mean, that's the type of community that you want to have whenever you're going down this journey.
Absolutely.
No matter where you're going.
Yeah.
And we have people that are attending the event that don't even know if they need, you know, IVF or surrogacy. Like they're coming just to learn, like in the event that they do need support, they want to know like, what's going to happen, or what to expect, or what the possibilities are.
Yes.
Because a lot of like heterosexual couples don't go through all the same testing that necessarily a gay couple goes through.
Or a single woman who's 35 and is like, should I freeze my eggs?
Yes.
I don't know what to do.
We'll help you learn about it.
Right. And like, that's exactly what we want. So anyone who has questions about their access to reproductive care, they should come and join us and, you know, speak to Katie and speak to other providers there about what are some ideas, what are some solutions, you know, for them, just because people are afraid to ask those questions, and Google is not going to give you the best answer. Like you have to speak with the source.
Absolutely. No. Oh my gosh. I couldn't have said it better myself. I'm sure every listener is so tired of me saying, don't go to Dr. Google, but it's true.
It's so true.
It's very true. Or Dr. ChatGPT. Like it's not going.
Oh, I know. Oh, Chatty. Oh no.
Chatty. Like sure, helpful, but not a doctor.
And you know, even outside of the doctor piece, just the finances, like we went into it kind of blind, knowing how we knew it was going to be a lot.
We were like, oh, this is expensive.
But like, you could Google until you're blue in the face. You will not find a solid answer, because everyone's journey is so different. And until you're in it and you start talking to people who really know what they're talking about, not Google, not ChatGPT, you're going to have a better understanding of like what the costs are going to be. And then then you could have bumps in the road that cost a little bit more, or you could save potentially on some decisions you make. So it can go either way.
And that is such a key point. Again, going back to the partners that you have been so careful of working with, it's very easy to go and, okay, well, I think I'm supposed to start here. And then you start trying to build that team, and unfortunately, not every person in this space is going to be transparent when it comes to finances or potential hurdles or, you know, things like that. And it is so important to be able to have, you know, kind of that, hey, I know that these are trusted providers. This is a trusted team. I don't have to do that part of the vetting process. Now I get to meet these people and talk with them.
Yeah, I mean, we knew right from this get-go, we wanted to have twins. We wanted one biologically related to Mike and one biologically related to me, but we wanted to make sure that they had the same egg donor biological parent, mother. And so we were shopping around for fertility clinics, and everyone was saying no. We got no so many times to twins. And so we finally found someone who, after 5 or 6 shopping around, finally found someone, and like that was our dream, and we wanted that to happen. And like coming to a Families Out Loud event, you could talk to so many clinics and agencies that will say like, yes, like we do this, we do double embryo transfers, or we don't, and like you're getting all that information in 10 minutes as opposed to days of work and time spent on it.
And just flagging the double embryo transfer conversation, right? Like I understand, and now we understand because of our story,
the risks
that are involved with that, and no one ever actually had that conversation with us, right?
Yeah.
And it is a dangerous journey, right, for the surrogate, for the unborn children, and we fully understand that. But no one explained that to us, which is, to George's point, what was super frustrating. We just got a no, not a why.
Right.
And so like that is what was most frustrating. What I do love about San Diego Fertility Center and about a lot of surrogacy agencies, even including Katie Nagdorn and Surrogate Solutions, is y'all listen, right? And like the thing is
and
that
explain.
And I think, like, again, what I like about SDFC is that what I always tell patients is that we listen, we advise, and ultimately allow you to make the decision that you as the intended parent is most comfortable with. So as long as you are being advised of what your risks are for your surrogate, for your unborn children, and for yourselves, and you are of sound mind making these decisions, okay.
Yeah,
absolutely. Well, again, that transparency and you're not a number, you're a person. We talk to you. You talk to people, Mike. That is so key in this whole journey from start to finish and beyond. And to be able to have those groups of providers and just trusted team members when you're choosing to build your family this way is so important, and being seen and being heard and being allowed to ask questions, and having maybe you're hearing no, or maybe you're hearing, well, traditionally, or maybe you're hearing,
I hate that word.
Right.
Like nothing about this is traditional.
Right. Yeah.
Exactly. So instead of hearing those things, let's okay, I received the information and here's what you need. Here's all of the
here's the risks, here's the pros, here's the cons, everything.
Is the data. I always
here's
tell
questions that you maybe didn't even think to ask.
Yes. Like the more data that you can have about a surrogate, about a donor, like the better, right? Like I think that the more information that you have, the better that you are. It's nothing in this entire journey is going to be perfect. Take that word out of your vocabulary if you're going through this journey.
There's going to be something.
Right. Life isn't perfect, but it's about the journey, and like everything is. I'm a firm believer in that everything that happens to you is supposed to happen to you, and you're supposed to learn from it. So here we are, right? Like, so we took the trauma that we went through. And we turned it into something positive because we said we don't want other people to go through that and to experience that. We want to try to help them avoid all of the pitfalls that we fell in, and try to pave the path rather than just look behind at all of the potholes that were left behind us. So that's sort of where all of this is coming from. And it's coming from a place of love, not only for the LGBTQIA plus community, but for everyone that we speak to, that we've seen, our friends of ours, extended friends and family acquaintances. And now that we have so much exposure in this world, everyone that we've interacted with who has a story, because all of us do.
And I think it's also great for people who aren't close to IVF or surrogacy. Like no one in our family had ever had to deal with any of that. And like they're very lucky that they were able to just like procreate naturally and without any obstacles. But like, even like showing like our parents and our friends who have never had any exposure to it, it's so important for them to see it as well.
Absolutely.
Just for more visibility.
Like what's so amazing is that my brother-in-law and his girlfriend are coming to our event. They're in their mid-20s, but they just want to learn about it, right? Like they just want to be a part of it. They want to see what we do. They want to experience the community and be a part of the celebration, right? And they're like, okay, like let's hear what this is all about. We're interested in what you're doing. And like that's amazing.
No, it absolutely is. Going off of just kind of that same track of whether you don't know or you haven't had experiences, what would you say maybe are some of the biggest misconceptions about whether you're part of the LGBTQ plus community or you're not? What do you hope Families Out Loud and coming to an event like that, or just being exposed to, all of the things that you guys are a part of, what do you hope will maybe break down some of, like, what misconceptions do you hope to break down?
I mean, one big one that always comes to mind when someone asks, like, what's the biggest misconception that we've seen is that you have to live right next to your surrogate or like in the same state as your surrogate.
There you go.
And that's not the case. I mean, our surrogate lived literally across the country, and we built a fantastic relationship with her. And how many visits do you really need to be there for the surrogate?
I mean, there's not a rule book, right?
Yeah.
When it comes to surrogate, I think it's a relationship that you develop with your surrogate, right? We made a few visits to our surrogate out in Mexico because we had a great relationship. You know, we did a photo shoot. We were present for a few ultrasounds. Like, we developed that relationship. So like, that was what was important to us. I think, you know, everyone's journey is different. And I think that whatever feels right for you and for the participants in your journey is what's right.
But we went into it thinking, oh my gosh, we have to find a surrogate in New Jersey. And we were looking for all the surrogates, and we're like, there's none in New Jersey. And we're like, what are we going to do? So we looked like Pennsylvania, and we're like, there's really none here. And we got further and further out. And then we're like, you know what? Like, let's just do it based on
the
who we get along with
yeah.
and the criteria.
Yeah.
And that was ultimately the best decision for us. But again, like, choosing your surrogate is all about the connection.
Mm-hmm.
And like, it's a really big trust process, right? So you really have to be connected. And so that's ultimately what we made our decision on. And she just happened to live on the other side of the country, which is fine. And it worked out, knock on wood. But yeah, that's how we got to that.
And I think proximity is one to what George is saying, is that not only your surrogate, but your egg donor, your clinic, right? So like, there's a huge misconception about geography and where you need to be. And we definitely hope to tear down those walls. But I think a misconception around having all of your providers siloed in one space. So like, clinic, donor, surrogate, everyone is under one umbrella, under what has been largely received as like a guarantee program or like an all-in-one stop shop. There's nothing bad about that. And I always tell intended parents, if that's what you are most comfortable with, and that is what feels good for you, by all means, do it, go for it. But what I like to advise people on is that, very much like a menu at a restaurant, right? You might be missing out on something really awesome a la carte as compared to the menu that's already been picked for you.
Or it's kind of like buying a house where you don't want everyone to be connected. Like, you want like your inspector to come in and like be advocating for you. You want your lawyer to be separate and advocate for you. And like, you need an external piece of that puzzle that's going to really advocate for you, because that's extremely important.
In our experiences, and what I would love for people to learn at Families Out Loud, is that having providers siloed predominantly, and what I mean by that is maybe egg donor and surrogate, fine, but like having your attorney having a separate relationship, having your clinic having a separate relationship. And I think there's a misconception that like going to one spot and getting all of your providers in one spot is the best way to do it, or the way that you're going to save the most money. And that's not actually the case. And I think that I would love for parents to be able to learn the differences between what a program like that looks like and a program that's more a la carte looks like. And again, making a decision that feels the most comfortable for them. Because listen, there are some people who are so busy, they can't project manage so far as to have conversations with other, providers. So like, for them,
you need the hand holding and like the guidance.
It makes sense to call one source and say, hey, one source, I'd love to have a baby, help me, right? And be done.
Right. Well, I think again, what makes Families Out Loud so great is maybe someone can't project manage, or maybe someone did just get so overwhelmed, and so they're like, oh, it's all here, it's done.
Right.
I don't have to worry about that part.
Right.
And you guys have essentially done that for them. Hey, these are all separate people, separate entities, but they're all here. So go talk to them.
Right. Exactly. And so we have done that, to your point.
Yeah, absolutely. For anyone, if you guys could maybe just go back and say to day one, Mike and George, just for anyone who is wanting to find out more, maybe they've had a really bumpy experience and they don't want to do that again, but they don't know where to start. What's maybe just some advice that you would want to give to anyone out there, no matter where they are on this journey?
Yeah, I think what we tell this to, I think, everyone is, it's a marathon. It is not a sprint. And it might seem like it's never going to end. And like we faced so many obstacles, and we were at some points we were like, is this the right thing? Like, should we just like, is this a sign that we should stop? It's not. Obstacles will make you so much, the end is so much sweeter once you get to it. Like, don't give up, keep going. It will finalize and come to a baby.
Yes.
And like you will be happy in the end. And it's just, you have to just keep pushing, because there's other opinions, there's other options, there's always going to be something that can happen after an obstacle. Just keep pushing. It's a marathon, not a sprint.
And with that too, is in somewhat the same vein, but a little bit different, is I always tell people as they enter the process, and I wish someone told us this, and it's that you are driving the bus, right? You drive the bus. And what I mean by that is that if you need to take breaks, it is okay. There is nothing saying that after you freeze your genetic material that you have to keep going. Take a psychological, financial break. It is okay. And no one should judge you for that, not including yourself.
Yes.
You know, after you've created embryos, it's okay to pause. You don't have to run and have your surrogate ready immediately, right? Like if you are going to be using a surrogate, that's fine, right? Like every single part of the process should be respected for its own individual part. And no, never let a provider influence you into the next step by timeline, or now someone's ready, or if you are not ready, then you're not ready.
This is your decision. And like, if you're not ready, do not move forward. Like just pause. Like it's okay. Take a breath.
I think that there are too many providers out there on all the rainbow of providers, from, you know, from clinic to donor to surrogate to mental health, everyone, who tend to shove rather than guide. And I think that that's, you know,
it happens in healthcare in general with surgeries and medication.
Sure, absolutely.
And it's like you would handle this with the same care that you would handle, you know, dealing with your own body and certain things, and like think about things and pause, and like, this is very expensive. Like pause if you need a second to catch up
for whatever reason. And I think no one should ever feel embarrassed about that, because I think there's a lot of misconceptions that like, oh, once you get on, it's like a freight train that you can't stop. And that's not it at all.
Yeah,
absolutely. Absolutely. And again, if you have given yourself the ability to be in spaces like Families Out Loud, where you can have community, having those people reaching out to other intended parents, or, you know, or parents that have already gone through this journey, or again, those trusted providers, and being able to get those opinions and maybe just affirmation of like, hey, where you are, what you're doing great. Because, and you've said it so many times, Mike, and it's so true. Everybody's journey is 100% unique. There is no quote right way to do this. Right. And you need to honor that, and having that community and space is so important. I love that so much. Okay, so what is next for Families Out Loud? Again, at the time of the recording, New York has not happened quite yet, but by the time this drops, New York will have happened. Yay! We were part of Austin. We're going to be in New York. We've been in New York. What's next?
So after New York, we definitely have San Diego on the docket. That's July 11th and 12th. We will also be at Seeds, which is super exciting. You mentioned Seeds a little bit earlier, which is the ethics board for IVF surrogacy. Basically,
yes, the Society of Ethics for Egg Donors and Surrogacy.
That's the one. Yeah, there you go. Good for you, because I didn't remember the acronym. But for sure, we're going to be there, which is going to be amazing. And then between all of us, we are in the process of planning one more city for 2025. So very excited for that. So that should be dropping soon. And then we'll have a full docket of events for 2026 and 2027 coming up. So super exciting. Super excited for the partnerships. Love that you and Katie and Egg Donor and Surrogate Solutions were one of our founding sponsors, and we'll forever treasure that relationship.
Thank you.
Yeah, as we grow and people learn about us and more awareness, we will take our, I would say, founding sponsors with us always.
100%. No, well, it's truly been an honor to get to be just a part of everything that you guys are doing, and it's just amazing what you guys are doing. And I love that you have created this space of community and safety and, just acceptance and just all of those things. It's beautiful. For all of those fun events, where do people go?
Yeah. So you can visit us at www.familiesoutloudevents.com or on our Instagram, which is at families_out_.
Perfect. And I will link those in the show notes.
Yes, thank you very much.
I love it. Okay. My last question, and it's a fun one. You guys have seen me. I'm dancing with my mic and my coffee cup over here. For anyone who knows me, they know that Coffee and I aren't far from each other. We love each other. I may be codependent. It's okay. But I always love to ask the question, what filled your cup today? Literally or figuratively, what's been the thing that's filled your cup?
I mean, for me, it's our kids. Like, we're in the process of purchasing a new house, and so we're going to go take measurements. I know, we're crazy, but we were taking measurements and like just like watching the kids like play around in their yard, like a new yard, like just having fun and wrestling in the grass. Like, we're sitting there like drinking our coffee, watching our kids play. It's literally like our dream come true.
Mm-hmm.
Yeah.
I love that. I mean, being that you took the like cute, like cliche one, like of course, I think for me today, what's filled my cup or what's in the process of filling my cup is just everything that we're doing for Families Out Loud. Like there's so much, and the small team that we even have here. A huge shout out to Chris, who is our Chief Marketing Officer, who has helped us from just about the very beginning, if not the very beginning, with so much. And now our friend Dylan, who is helping us as well with a lot of the social media stuff. The two of them, along with obviously my husband, not to get too sappy, just like along this entire journey, that's what fills my cup every single day is like what we're building. And I get excited by the reach outs that we get from our sponsors or prospective sponsors or intended families reaching out. And that just every day I'm like, okay, because there's always trepidation, right? Like
this is very much a grassroots effort, right? And like, it's like just us three doing it. And
being an entrepreneur is scary. And it's just like, we're going into this and we're like, okay, are we doing the right thing? And every single day I'm like, okay, we're doing the right thing. This is the right thing. So it feels good.
Yeah. Thank you everyone for supporting us. And it literally means the world that we can like make something out of this idea. So we're so excited.
Yes, for sure.
Well, your passion and excitement is, it's contagious, and it makes me just so happy and excited that we get to be part of it. So thank you guys so much.
Thank you, Whitney. We appreciate it.
Absolutely. And again, check out Families Out Loud events.com and then all of the underscores on social media.
That's correct.
Thank you so much for joining us on this episode of Me, You, and Who. We appreciate your time and hope you enjoyed our discussion today. As we wrap, we would like to remind you of some of the ways that you can stay connected with us and be part of the Me, You, and Who podcast community. Firstly, if you haven't already, make sure to subscribe to our podcast on your favorite platform. Hit that subscribe button so you never miss an episode and can stay up to date with our latest content. But that's not all. We also have an exciting YouTube channel where we share some bonus content, behind the scenes glimpses, and video versions of our episodes. Head over to YouTube and hit that subscribe button there as well. And don't forget to click the notification bell so you'll be the first to know when the new episodes go live. And for more exclusive updates, engaging discussions, and a chance to connect with fellow listeners. Be sure to follow us on our social media accounts. You can find us on Instagram, Facebook, and TikTok at Create a Happy Family. If you're interested in finding out more about creating a happy family, please visit us at www.createahappyfamily.com. Thank you again for being part of the Me, You, and Who community. Your support means the world to us. I can't wait for you to join us next time as we continue to share stories and journeys of creating happy families.